Okay, so if you'd be able to tell us a little bit about what kind of tests people with EPP should be having on a regular basis, and roughly how regular those might be.
Yeah, and that is very important actually, because what we're looking for various things. So the point of the appointments that are usually once a year, unless there are particular problems, usually about once a year, is partly to sort of discuss treatments for the skin and for the photosensitivity and all those sort of things, but also looking for other things. And one of the things is the rare complication, and it is very rare, of liver disease. But because it can be serious, we take it very seriously, even though it's not going to affect most people. So we check the liver tests every year. And the liver test that's always been done, and still the standard, is the blood test. We are getting involved, things always develop, and we're trying to see where we are, whether there's a little scanner that we've got, whether that helps as well, as a sort of annual liver test. It's called the FibroScan, and we're trying it on people who are coming to see us at the moment. Many of the people coming to see us, and we're seeing whether it's useful in EPP. We don't know, but certainly monitoring the liver, I think, is important, because if there is a problem, then one obviously does want to get help from a liver specialist and get things sorted out, rather than because not realizing and then not realizing that actually maybe there's a serious problem developing. So I think that's the main thing. So we send off the liver tests, and we also send off the porphyrin levels, and the reason for that again is really related to the liver. If there is a liver problem, then the porphyrin levels year after year will keep on going up and up and up and get very high. The porphyrin levels, you'll find when you go to clinic, that 1 year to the next they can actually fluctuate a lot. Can be higher 1 year, lower the next year. But I think what we're looking for is a sort of steady increase over 2 or 3 years, particularly if we start getting very high levels, which are higher than the usual in EPP, the standard sort of levels. And that might be a suggestion that the liver's struggling to get rid of the porphyrin from the body, because that's how the porphyrin's got rid of from the body. Yeah.
Excellent. And can I ask whether those tests need to be done at a specialist testing centre, or can they be done more locally through a local dermatologist?
So that's a good point. I mean, so the tests can all be sent. The porphyrin test, sometimes the labs in the small hospitals struggle to deal with it and send it off to the right lab. But apart from that, the other blood tests can all be done in a local hospital. And I suppose the question is how comfortable is your dermatologist, how familiar is your dermatologist with the disease, and the appointment would be partly about it, but how comfortable are they with monitoring the liver tests in EPP, or how familiar are they with and confident with the skin side, or all the other issues that come in with EPP. Yeah. So that would in a way be more about those where to see, and there are quite a lot of doctors, not just dermatologists, but who'd sort of think, well, I think this is the sort of thing that is quite rare, so maybe we'll leave it to people who spend a lot of time, doctors and nurses and scientists who spend a lot of time concentrating on porphyria. So that's why we have the specialist centres. So I think part of it is that we can do different tests. We're doing these scans, and the porphyrin tests are easier to do. But I think a lot of it is actually simply having people, seeing people who've got the experience, that they've seen. They've met a lot of people with EPP and sort of understand what happens in EPP.
Yeah. Know how to interpret those tests.
Yeah, I think so. Exactly. Yeah, it's about the interpreting. Absolutely.
Yeah. So can I ask you about vitamin D? Because a lot of people find that they're vitamin D deficient.
Yeah, so that is important. Okay, so vitamin D is mostly produced. Some of it comes from your diet, but most of it is produced in the skin from a chemical reaction that happens with ultraviolet from sunlight that gets on the skin. Anybody who has a problem where they have to protect themselves from sunlight and avoid sunlight may become have too little vitamin D in them. Vitamin D anyway, because we live, a long way north in the world. There's a lot of people have a vitamin D level in this country that's lower than is ideal anyway. But I think in people with EPP, we've found that it can be very low indeed, simply because people have to avoid sun exposure, and it can be replaced. It's straightforward as long as you take a vitamin D supplement. It's just a tablet of usually 1,000 units a day of vitamin D3, and you can buy it from a chemist or a health food shop. But I think it's important to do, and it's important that somebody is measuring the level of vitamin D in the blood. Vitamin D is important for looking after the bones, and it's particularly important, I think, the age when it becomes important is more important as one gets older, and particularly in women, where thin bones are quite a common problem, in middle age in women, middle age and old age in women, and you're more prone to get osteoporosis, thin bones, if you are vitamin D deficient. The other thing that's been found is that people with so measuring vitamin D and taking vitamin D is important. It turns out that people with EPP quite often do have osteoporosis, thin bones, more often than we expected, and it often develops sort of in reasonably young ages, younger than it happens generally in people normally.
Yeah.
Often in the 30s or early 40s. And there are two reasons for that. One seems to be that the vitamin D deficiency is one thing, and we can deal with that very easy. The other is the problem that not being able to go outside for the more outdoor part of the year for most people, which is the spring and summer, reduces physical activity. It's bound to, because when everybody else is going and playing a game of football in the blazing sun, you can't do it. And so levels of physical activity are generally lower as an average. Obviously, it varies from one person to another, but as an average, they're lower in people with EPP than they are with other people, because there are these difficulties and limitations. And that also is the thing that protects your bones if you've got lots of physical activity. As a result, the osteoporosis happens because of the effect on physical activity and the effect on vitamin D. We can sort out the vitamin D, and I think it's important for people with EPP to be aware that when they can't go outside and do the normal sporting things and walking and all those sort of things that they'd like to do, that if they can start thinking about indoor substitutes in gyms or at home or something rather, it's well worth doing, because it does protect the bones.
Excellent, thank you. And what about iron deficiency? Some people find that quite anemic.
So it's a bit tricky, the iron deficiency. So iron deficiency is the commonest cause anyway in everybody, not just EPP, is the commonest cause of anemia. Anemia is not having enough hemoglobin, the red pigment in your blood that carries around oxygen. And it's common anyway to be anemic, and the commonest cause of being anemic is iron deficiency, and that is very often, most commonly, sort of young women due to heavy periods, and therefore blood loss, and therefore you lose iron with the blood loss. With EPP, it's a bit complicated. So somebody with EPP can get anemia just as often as anybody else gets anemia, for exactly the same reasons, because of heavy periods or because of some other cause, or dietary lack or something like that. But the problem is that what makes it complicated is that people with EPP very often start with a very mild anemia normally. So just very slight, but the blood level of the hemoglobin will be a little bit on the low side, but not enough to make anybody feel tired or ill. And that's just the way it's set. That can just be part of the condition. And then the other thing that can happen is that EPP can make it look on the blood tests as though you're iron deficient. But that's actually, the blood test can fail. The blood test for something called ferritin, which is one of the iron tests, can fail, and it looks low in people with EPP even though they're not iron deficient, and that's just part of EPP. Now that means that when your GP takes your blood and checks your blood, your GP may well come back to you and say, I think you've got iron deficiency anemia, because you've got the blood test for ferritin is low, and the GP, there's no way the GP should know that ferritin happens to be low in EPP anyway, and because a little bit of anemia is very common in EPP lifelong. Now you can then your GP would obviously put you on iron. You go on iron tablets. Iron tablets are a little bit unpredictable in EPP. They certainly, some people when they go on iron, it seems to improve their porphyria a bit. Some people it seems to do nothing, but there are a few people who react very badly to having iron in EPP, and it upsets the liver a lot. And it not only makes the photosensitivity worse, but it can really upset the liver. It's not very common, but it's a danger. So the danger is that people get treated for iron deficiency anemia when they haven't actually got it. And well-meaning doctors who come across people with EPP sort of say, oh, you've got iron deficiency anemia, take some iron tablets, and then that person happens to be the unlucky person who has the bad reaction with their liver or with their skin with the EPP, to the iron. So I think the way to do it, from what we do, is we know what the normal level of hemoglobin is, what the normal level is, whether that person's a little bit anemic normally or not. Do they have 11, a level of 11 or 12 or 13 or whatever we measure for the hemoglobin level for the anemia, and we know if they're a little bit anemic. And then what we're interested in is if it suddenly goes much lower than their normal. So one thing is it anemic? Is it different to what one normally has, or is it just what you're always like? Yeah. And the second thing is ferritin. The ferritin test is misleading in EPP and is not the one that should be done. If somebody definitely has developed iron deficiency anemia in addition to the normal changes you see in EPP, then if they really do need iron tablets, and people do, then we tend to use a small amount of the iron tablets, quite a low dose, and with monitoring of the liver function about every month or so, just doing a simple liver test. So we're sort of cautious. So if any well-meaning medical people sort of suggest that you're iron deficient and would you consider going on some iron, just say there are some issues about iron in EPP, and I'll ask my specialist, and maybe you can sort it out because it's complicated.
Yeah, that's very good. Kind of reiterates the whole idea of actually having specialist care who can do those tests regularly and interpret them.
I think so. I think it's a tricky one. It's a tricky one, but I suppose, the answer is you may not have iron deficiency when you've been told you have got it, and then the iron tablets are used for iron deficiency that's not necessarily actually there, and then if you're really unlucky, they might use some harm. So it's a tricky thing, because equally lots of people with EPP get iron deficiency anemia, because everybody gets iron deficiency anemia.
Thank you, that's really, really helpful.